about the importance of social health and social capital in long-term disaster recovery, like what we've just seen here on the East Coast this past couple months.
Yeah, and if you don't remember who we are, what our nonprofits stand for, or all that stuff, you can just go back to the first video episodes and check it out then. Tell us what we're going to talk about today, though.
Today, we are talking about why it's important to build partnerships around social health and give money to find funding for social health efforts in the wake of a disaster. So maybe you can get us started with a little like reminder of what social health is, what social capital is, Krystal.
Yeah. Yeah, let me go. So free leadership is more about social capital and SeekHealing is more about social health. Where there's a shared Venn diagram that's pretty big in
Definitely.
the middle. Um, but social capital is the tangible and intangible benefits that come through our social networks. And one of them could be social health, which we'll talk about. Why this is important is that there's tons of research showing that in the last 25 years, our social capital is rapidly declining. Like, I think something out of 2018, which is now outdated, showed that I think is 35% drop in 25 years of people having friends over to their
Yeah.
house. And family dinners are at like 43% less in the last 20 plus years. And then also like attending club meetings or being in organizations or memberships are down like up, I think down like 30 to 40%. So what we can see is social capital is rapidly declining and less people are engaged and actively like building solid relationships with their neighbors and their communities and the day-to-day people that they interact with. How about social health?
Yeah, well, and I'm sure it's like very clear the through line here to the health impacts of what you're talking about, Krystal. Like so from a social health perspective, we're thinking about how that impacts people's health and wellness. The US Surgeon General declared that we're in a national crisis and epidemic of loneliness in the summer of 2023. So really drawing attention to how these trends that you just named are resulting in a world where people are experiencing the negative health effects of loneliness and social isolation. That includes physical health effects. Loneliness has been linked to all kinds of medical issues like obesity, chronic illness, all kinds of different heart conditions, and as well as, and particularly close to my heart, very clearly linked with mental health challenges and acute mental health symptoms, specifically substance use and more severe expressions of anxiety and depression. So I'm really concerned with the organization that I work with, SeekHealing, and organizations like ours that are focused on improving social health in um, working alongside other health providers and nonprofit organizations and community are to really address the places where those health inequities are most um, glaring, because as any epidemic at a national level, this of course is impacting folks who are systemically disadvantaged by our health delivery systems, especially Black, Brown, and Indigenous people, young people, older adults, and members of the LGBTQ community.
Right. And especially in disaster recovery, what we know is that social capital and social health, those two things, are mediating factors of how effective people can recover from, well, all sorts of things. But disaster is one of them, especially when you have multiple entities, organizations, communities, houses, humans in one area that are going through a significant trauma called disaster, we see that there are these moderating factors of how well they can be resilient and how well they can respond. And one of them is social health, kind of the emotional and yeah, I would say the emotional benefits of being in high trust, emotionally rewarding connections.
Yeah.
I just
Feeling
paraphrase.
that sense of belonging, feeling
Yeah.
like I know how to give my energy and community, and I know where I can go to receive support from people around me.
Yeah. And then social capital is like the leadership aspect of engagement in your society. Like, where are you getting your information? Do you believe in mutual reciprocity? Do you trust your neighbors, right? Are you generating some sort of volunteerism? And also, are you willing or and able and ready to receive? Like all those things are really in play here for how well we can respond during this disaster. Especially, we both live in the Asheville area, and Appalachia is much more beyond Asheville. I just want to say that when people talk
Mm,
about the hurricane that hit Asheville,
of
it's
course.
not just Asheville, it's the surrounding areas, especially SeekHealing is in, like, you've got 3 locations in Appalachia, right?
We have two physical locations, but one in Haywood County as well as the one in Buncombe County. But I just appreciate you saying that and like shout out to all of our friends and loved ones in Swain County, Jackson County, Macon County, Madison County. This disaster impacted our entire region.
Yeah, and especially when we look at how we respond socially to these disasters, we are going to see, and there will be research in a couple of years of what counties actually want cities, because just out there for our civic understanding, we've got county leaders and we've got city leaders, and they are
Mm.
different. Then we have federal leaders, different, different, different. And then we have organizational leaders, different, different, different. Just like you and I are different, Genesis, we have differences and similarities, and we're seeing all of that happen in this disaster recovery process. And why we're doing this video is, one, just to bring awareness to nonprofits who are really focused on social well-being in disasters and in general, but especially in disaster recovery. And then two, to ask for your support. um, so we rely on, well, our work is emotional support and social support, and so we really rely on this in order to continue our work. So why should people actually donate their time, their talent? We're always looking for a professional to donate their talent or their money to causes like ours. And we both have recovery campaigns, by the way.
Yeah, which we'll link in here. And yeah, it just is so critical. I want to like shout out specifically for any technology donations that are out there. Any technologists who are out there looking to contribute their time. That's something that we're really needing right now. Um, but that I'm thinking of specifically that, for those of us who were in Western Appalachia and um, Tennessee, northern Georgia, when Helene hit, you probably experienced this. And if you don't live there, you probably heard about this incredible surge of community coming together in those immediate days after the hurricane. It's a fascinating phenomenon from a social health and social capital perspective that humans, when a trauma happens, it's the first thing that we do, right? We are just inherently such social creatures. And we figure out how to come together in order to support each other and make it through a crisis like that. And what we're really seeing, and what Krystal and I and organizations like ours really stand for in the world, is like that kind of coming together we have to figure out a way to sustain that
Right.
outside of disaster times, outside of times of trauma, so that we can be resilient for the future disasters, and so that we can just survive in a world where connection is increasingly less and less common. So donating dollars to or helping us form partnerships with entities that fund this kind of work ensures that we are actually fueling the energy and emotional and energetic effort that it requires to make mutual aid networks effective. Mutual aid relies on social capital. And in a world where individuals are suffering from the impacts of loneliness, they're unwell, they're struggling with their health or their mental health because they're lonely and disconnected and not feeling that sense of belonging, that adds up to regions and communities and cities where people don't know how to collaborate or come together effectively in the ways that we're describing are so necessary. So donating to efforts like this means that we're equipping, and it is slow, beautiful, slow, but micro work, right? Like we're equipping one human, one relationship at a time to be more resourced for that kind of connection that elevates our whole social structure when we have disasters like this happen.
Yeah, and I know it's easy to give food, or it's easy to give household belongings or basic needs like shelter, water, food when somebody experiences a disaster. But what we need long term are, we need social networks that are are steady and sturdy, and we need social circles. And that's one thing I love about SeekHealing is that there's evidence-based listening, connection circles that provides a sense of belonging and actually like human resources that gets you the motivation and the fuel to actually access some of the other benefits that are available in our community because of the disaster. And then also what we really need is a cadre of humans that are here in this area right now that are not burnt out, that are not running on empty, that are not so overwhelmed by their own traumas. And you get in a room right now here where we live, and it's 9 out of 10 people that have had some kind of personal loss during this storm and its recovery. So what you're investing in when you donate to one of our campaigns is you're investing in the future and the well-being of leaders who are really already doing the social capital and human resources and social health work on the ground here. And your donation, again, time, talent, and your money and your treasures really enables us to buoy the well-being of leaders on the ground here.
That's exactly
Yeah,
right. And I just want to add that that was something that we saw really clearly in collaboration with FEMA distribution sites and other mutual aid hubs during the acute phase of the hurricane. Now, as we're moving into long-term recovery, that, people are showing up because they need clean water, they need food, they need paper supplies, need somewhere to live. And there was very real and active need to tell their stories, to be heard, for their bodies to come down from the active trauma response that they're navigating. And while I don't in any way want to seem or appear ungrateful for the incredible aid and donations that came in from across the region to support us, there is also something that's like really important about being able to count on getting that support from the community where you live and knowing how to access it, and receiving, along with your bottles of water and the hot meals, a warm smile, a sense of belonging, I believe you got this from a neighbor who knows your face,
right,
and who's
right.
going to be alongside you as you continue to walk this road into the future, is just really immeasurable for the future of our communities, for the resiliency of, for economic development in the generations after this that will be impacted by this disaster. We,
Right.
we need that sense of security in each other in order to survive.
Yeah. And as a society, let's just say United States of America, we need to rebrand saving a life as being a fire. Although, thank you to all the emergency rescue people, but saving a life is not just like the Hollywood show that or Hollywood scene that we have for saving a life. It also is investing in the what's in here and what's in here of one another. And that really is what you are doing if you decide to um, contribute to our campaigns here, is that our recovery campaigns really are lean campaigns that are showing outcomes where you are improving the well-being both socially and emotionally for the leaders and everyday people that live and continue to work here. And the recovery is going to take all of 2025. So this won't be your first opportunity and it won't be your last. And whenever you're watching this, we need you. Um, so you can find out where to reach both of us in the links that are provided here. And I just want to say thank you. And you all should know that I'm wanting and just applauding all of your work, Genesis. Like it's humbling to actually participate in myself, and then also just inspiring as a collaborator and a peer. So thank you
Mm.
for being you.
Yeah, thank you, Crystal. And thank you for the work that you're doing with Freedom Leadership and the way that we're getting this message out into the world. I just think is so important. It's the root cause, we like get all, I'm sure we've all had contact with that anxiety of like, wow, what is happening in this world? And I just really believe that addressing these issues of social capital and social health, are some of the highest impact work that we can do with the greatest trickle down effect. And I see you dedicating all of your time and energy to that. And I'm so grateful.
Yeah. Okay. Well,
I'm so grateful to all of you out there. Thank you for
yeah.
listening.
Thanks for listening. We'll catch you next time. We have one more to go. Bye.